Hi, I'm Stephanie Hernandez, Director of Advanced Practice Providers at Arthritis Knee Pain Centers. If you're dealing with knee pain and want to explore non-surgical, non-opioid options for relief, you're in the right place. We believe in combining advanced therapies, supportive devices, and lifestyle and nutritional guidance so you can reclaim mobility, reduce pain, and live the life you enjoy. Today, I'll walk you through 6 key options we offer so you can better understand what they are, how they work, and whether they're right for you. Don't forget to like this video and subscribe to our channel. Let's dive in. At Arthritis Knee Pain Centers, our primary treatment is knee gel injections, also called viscosupplementation, specifically tailored for people with osteoarthritis. In this procedure, a gel-like substance is injected into the knee joint, replacing or supplementing the natural synovial fluid. This helps lubricate the joint and acts as a shock absorber. Our doctors use fluoroscopy, a live motion X-ray, to see exactly where the injection goes, ensuring accuracy every time. Here's what you can expect. This treatment is offered at each of our medical practices. The treatment is a series of injections, usually taking 3 to 5 weeks in total. Some patients experience immediate relief, while others may take several weeks to feel the full benefit. Relief can last for months depending on the patient. Medicare and most insurance plans cover knee gel injections, and treatments can be repeated every 6 months for ongoing relief. While there is no cure for osteoarthritis, this treatment has helped many patients avoid the risks associated with opioids and knee replacement surgery. Through a no-charge screening, we can help you determine if you're a candidate for knee gel injections. Now let's talk about Genicular Artery Embolization, or GAE. GAE is another non-surgical option for people who experience residual knee pain and inflammation, even after you've tried other treatments. It may surprise you to learn that people who have had knee replacement surgery may also be good candidates for GAE. Here's how it works. First, a local anesthesia is applied, and your doctor makes a small pinhole entry to insert a catheter in the leg. No incisions necessary. A special dye shows up on a live X-ray called fluoroscopy, helping your physician see the exact arteries feeding the inflamed area. Then, those tiny beads are gently released to block the abnormal vessels. GAE reduces inflammation, calms irritated nerves, and helps to reduce your knee pain with minimal downtime. If you think you may be a good candidate for GAE, call us or schedule a no-charge screening at arthritiskneepain.com. It's important to note that non-injection treatments matter too. One of our key treatment protocols is a custom unloader knee brace, often called an offloading knee brace. We customize the knee brace to take off the maximum amount of force where you have the least amount of cartilage. At Arthritis Knee Pain Centers, we fit these with precision for each patient. Data shows that when these braces are used in conjunction with other treatments, such as knee gel injections, the results are better. Here's how it helps. The offloading brace stabilizes the knee by redistributing weight and decreasing stress on the arthritic portion of the joint. Because less load equals less wear equals less pain. You may be wondering what our patients say about these braces. Many report increased stability, greater confidence when standing, and reduced pain with walking or other activity. Evidence shows that proper bracing can slow the progression of osteoarthritis when used in conjunction with other therapies. We have another video that goes into more in depth on the benefits of these braces and how to use them to maximize your pain relief. Be sure to watch that on our YouTube channel. At Arthritis Knee Pain Center, our goal is to give you a better quality of life. Offloading braces allow you to walk longer, exercise more, and do your favorite activities more confidently. Another advanced treatment we offer is platelet-rich plasma, or PRP, which is often used by professional athletes. PRP harnesses your body's healing mechanisms by concentrating your platelets, which contain growth factors, and injecting them into the knee joint to hasten the repair of damaged tissue, reduce inflammation, and improve joint function. Here's how it works. We draw a small sample of your blood, normally from the arm, spin it in a centrifuge to concentrate the platelets, prepare the PRP, and then inject it precisely into the affected area using a live motion X-ray called fluoroscopy to ensure optimal placement. Studies indicate that PRP is safe and may lead to meaningful pain relief and functional improvement in knee osteoarthritis and other injuries over 6 to 12 months or longer. For example, a Mayo Clinic study reported a 60 to 70% success rate in pain relief for patients at their 6 and 12-month follow-ups. Our physicians can help you determine if you're a good candidate for PRP. Similar to GAE and knee braces, PRP can be done in conjunction with viscosupplementation gel injections. Learn more about PRP on our YouTube channel or schedule a no-charge screening at arthritiskneepain.com. While our primary focus is on knees, we know that back pain can often coexist, especially when knee pain may alter gait or posture. At Arthritis Knee Pain Centers, we also offer an advanced orthotic back brace for relief of lower back pain, improved posture, and restored mobility. Here's why this is relevant. Poor posture or walking patterns, often caused by knee pain, can put extra strain on the spine. By stabilizing the back with a quality brace, we help minimize strain, reduce pain, and support overall mobility. What are the key features? The back brace is designed for daily use, it's adjustable, it's lightweight, and it lets you move freely while supporting the spine. When do we recommend a back brace? If knee pain is affecting how you walk, stand, or shift your weight, and you're developing secondary back or hip strain, our back braces may be a great option for you. Good nutrition plays a big role in keeping your knees healthy. At Arthritis Knee Pain Centers, we offer specially formulated supplements that can help support your joints and reduce inflammation. Why do we recommend them? When your body doesn't get the right nutrients, it can make knee pain and stiffness worse. Some supplements support knee health, but remember, they're meant to help your treatment, not replace it. For example, supplements like glucosamine and chondroitin have been studied for knee joint pain, and many patients say they feel less pain when taking them. Our team always reviews your overall health before recommending anything. We make sure your supplements fit safely with your other treatments, like bracing, injections, or therapy, and that you're getting good quality products. At Arthritis Knee Pain Centers, we change lives. We relieve pain and restore mobility. We help people to stay healthy, be active, and love life. If you're ready to explore what's right for your knees, we invite you to schedule a no-charge, no-obligation screening with our team. We'll evaluate your specific situation and craft a personalized treatment plan. Because you don't have to live with knee pain. You deserve better. Let's get you back to the life you love.